Hi, thank you for joining us today. I'm David Hall, CEO at TAMP, and today we're excited to have Dr. Karim Sandid. Dr. Sandid is a Doctor-Innovator-Facilitator here at TAMP. He's on our advisory board and also the Chief DIUP, that's Digital Innovation Upskilling Program Advisor. Dr. Sandid is a practicing medical doctor, a GP, general practitioner at the NHS in the UK. Dr. Sandid is also pursuing his master's degree in healthcare and design at the Royal College of Art and Imperial College. And Dr. Sandid is extremely passionate about person-centered design, person-centered care, and human-centered design. Dr. Sandid, please share with us your journey, how you became a doctor innovator, why you saw the need, and why you had the desire to become a doctor innovator.
Thank you, David. It's a pleasure to be here and to be able to share my story with other doctors. So when did I get interested into innovation and becoming a doctor innovator? I would say it was back in 2016. So I finished my training as a family doctor, general practitioner in 2015. And in my everyday practice, I really noticed the gap between the tools I had and the tools I needed as a doctor. So I didn't have enough time with patients to provide the care I wanted to, not all the resources to, and the time of the consultation wasn't necessarily the best time to give information to patients. And I was much more interested in patient education, health education. So since I didn't see the relevant tools in the on the market, I just thought, let's create them myself. And so I started to get interested into innovation, and so I started doing a master in educational health at the time. So I learned by doing, really. So did a few projects, had failures obviously, but really learned a lot and learned that it was possible to design things myself as a doctor, and that probably that would make innovations which would be more relevant for both patients and clinicians. And so then along the way, I noticed that the skills I was lacking were probably more around design thinking, design. So because really design is a really powerful tool to solve problems, to find solutions to problems. So yeah, that's why I got interested into it, and I started the Master Healthcare and Design at the Royal College of Art and Imperial in London.
Wow, thank you so much, Dr. Sandid, for sharing that truly inspiring story on your journey to becoming a doctor innovator. I'd like to now ask you, what advice would you give to your doctor peers, your colleagues around the world as they pursue their journey of becoming a doctor innovator in this digital VUCA world?
So the advice I would give to my my colleagues, my doctors' colleagues, would be, so first, if you think about starting doing things, we've all been through, and maybe we'll always be, I don't know, with the imposter syndrome. So having the feeling like you're an imposter, you're not the relevant person, you don't have the relevant skills to like innovate because you're not like an engineer or these kind of things. But I would say that when you start doing things, you get more confidence and like positive feedback, and you really notice and learn that in the end you have already a lot of really valuable skills to innovate. So that's like to begin the journey, I would say, for the colleagues who have begun the journey, went through tough times, didn't like manage to get their innovation through. my advice would be to keep going. It's always easy to say, but we all go through failures, but that's every time that's really a huge opportunity to learn and to do things differently next time. And for sure, innovation will need us as doctors to participate, to design it, not just to use it. And innovation won't be the end. So even things like artificial intelligence will never replace doctors. That will be just another tool at our disposal to eliminate all the repetitive tasks and maybe focus more on the human aspect, the complexity aspect of things. Back in time when the MRI scans were discovered, I remember, or I read, because I wasn't there, but neurologists were like afraid that maybe their discipline will disappear because they wouldn't need all this really specific clinical and physical examination that allowed them to diagnose, all right, so the stroke is this branch of this artery. But in the end, it was just another tool, same for the chest x-ray and other things. So yeah, really, it could also bring much more creativity in the process for them doing different things. And so that could also help, I think, to do less repetitive tasks, to have an additional activity, and to be more even happier doing your clinical work. So really don't hesitate to jump in. There are a lot of positive outcomes for you in the journey.
Thank you very much, Dr. Sandid, for sharing those suggestions to your doctor peers, doctor colleagues around the world. I'm sure they will find it very inspiring as well. And now I'd like to just finish up by asking you to share your thoughts based on your knowledge and experience and expertise of where you see the future of healthcare going.
And in terms of the most important innovations I see in healthcare in the future, I think there will be really disruptive innovations for sure, but I also see kind of a continuity in what has existed so far, in the sense that the relationship between the patient and the healthcare professional, the human relationship, I think is something both patients and clinicians will always look for. So I really see much more, maybe after like trends and trendy innovations, I will see much more technologies be used to augment this existing relationship. So yeah, once again, tools to augment, but not to replace the existing. But for sure, the healthcare would be much more proactive, much more about prevention, much more about risk, and yeah, managing complexity and uncertainty. So exciting times ahead for sure.
Thank you very much, Dr. Sandid, for being here today and sharing your inspiring journey with other doctors around the world. We hope we have inspired you here today to continue or to start to pursue your own journey as a doctor innovator. Thank you.